Next witness, please, 1 minute.
Hello, my name is Astrid Zuniga. I'm from Stanislaus County, Modesto, California. I'm a home care provider for 2 clients, one of which is my son and the other is my father. And we are asking that you support the restoration of the 7% of hours and the MCO tax, in which would help to fund that. At the end of the day, it is about the continuity of care for these individuals and them not having to choose between being bathed or having a meal prepared for them. And at the end of the day, that's all that matters. These are elderly, disabled individuals, and they deserve dignity and respect in their home and not having to choose which services they receive. Thank you very much.
Thank you very much. Next witness, please.
Good afternoon. My name is Jessie Torres, and I am a single parent, and I am a home care provider. Also, I represent my daughter legally. My daughter, her name is Cecia, and she was born as a beautiful little girl. At 18 months, her health had deteriorated. I had to make a decision as if a regular daycare or a home care would have been best for her. So I am here to support the MCO to ask to restore the 7% cut. Due to that, I have to be an advocate because I don't have the privilege as other parents for my client and my daughter to speak up and say, today, somebody wasn't able to treat me right. Somebody wasn't able to give me paramedical services. Somebody wasn't there to take care of my hygiene. As a mother, I have a responsibility to care for my daughter, but as a caregiver, I have to cover paramedical services and protective supervision at home and care for her, and I do not get paid as a doctor, as a nurse, as a judge, as an attorney. They get paid 24 hours for their care, for their certification, and for their license. I went ahead and I did my certification, my licensing to care for my daughter, and I'm still a home care provider. I am proud to be a mom. Thank you.
Thank you very much for your testimony. Next witness, please, 1 minute.
Madam Chair, members, Julian Navoris on behalf of the Urban Counties Caucus. We have a support and concept on the MCO tax. We realize it's still a work in progress, that you're still having discussions with the plans, but we also realize that it's wrapped up in several budget proposals that we really care about. One of which is the Coordinated Care Initiative, which we want to see succeed, and the other is IHSS 7% cut. So we would encourage the committee and the administration to try and resolve the issues that CMS has this year. Thank you.
Thank you very much. Final witness.
Tam Ma with Health Access California. We support an MCO tax that complies with federal guidelines and appreciate the committee keeping this item open as this is still a work in progress. Thank you.
Thank you very much. Given the fact that the department is still in negotiations with the plans and looking at alternatives, the committee will hold this item open. And let me just say for the public, the fact that the committee this early in the budget kind of process holding items open should not be an indicator of support or opposition, merely that we're holding the items open for future consideration post-May revise. So we'll be holding this item open as well. Okay, moving on to item number 9. The elimination of the COLA for county eligibility admin.
Sure. So this proposal would make permanent legislative intent language with respect to COLAs for county admin funding for 15-16 and subsequent fiscal years, unless otherwise appropriated in the budget. Since 2008-9, trailer bills each year have included language to suspend the COLAs, and this seeks to make that language permanent. With respect to the new methodology, we will be working with our county partners and other stakeholders on the new methodology for budgeting county administration funds. But as we've sort of talked about a lot, nothing is stabilized yet in terms of enrollment and the issues that we talked about in the Cal HERES side. So we need a little bit more time till things stabilize to really help determine what is the steady state of county administration and what's the best methodology for funding it.
Thank you. LAO?
Amber DG, Legislative Analyst's Office. We recommend the legislature reject the proposed trailer bill language and continue to determine whether to suspend the COLA through the annual budget process, as has been done over the past several years. We find the decision of whether the COLA should be ongoing should be considered during the development of the new budget methodology for county administrative funding.
Thank you. Finance?
Jennifer Lopez, Department of Finance. I'd like to note that this proposal is consistent with the administration's policy to eliminate COLAs statewide. It's merely striking intent language, and it doesn't take away the legislature's authority to augment the budget. We also do want to note that the state has provided significant augmentations to county for the implementation of the Affordable Care Act. Thank you.
So since you raised the point of the administration's desire to eliminate COLAs across the board, why is that a better option from your perspective versus doing it annually as needed based on costs? Because to simply then punt the ball into our lap for the legislature to then go back and do increases, that's challenging also to get you to agree to increases in anything.
Yanni, Department of Finance. Well, with the current, as what Ms. Cantwell stated, with the current language as this and their intent language, we have to come back every year to strike out that. So right now, I mean, the budget doesn't include any COLA at the moment, to the extent that without this language, there's no need for us to come back every year and try to strike out intent language.
Okay, and so my point is, when I look at a variety of programs where we have unfortunately permanently eliminated COLAs, CalWorks, SSI, the burden is then on the legislature every year to fight with the department to talk about the value of some kind of cost of living adjustment. The permanent elimination of COLAs across the board, as you said, because it's not in the budget anywhere, creates a scenario where CalWorks, SSI are making payments equivalent to levels in the 1980s. So the burden, my point is, should the burden be on the legislature or on the administration that in budget years when it's necessary to eliminate a COLA, to do so, versus an across-the-board elimination where these programs never catch up?
I would say that the burden's on both the administration and the legislature.
Okay.
So as we engage with stakeholders, as they express their concerns, we are also, having those discussions.
Okay, fair enough. Senator Monning, did you want to?
Yeah, I would just share the same concern to the extent that our budget and the administration's budget is a moral blueprint for the state to say we're going to just strike COLAs as a matter of practice. That creates a pretty dim future for people that are living on the margins, be they providers, recipients, or employees of state agencies. So I would hope it would be rethought along the lines that the chair indicated. We shouldn't be the sole body that determines whether or not a COLA is appropriate or whether there's funding for it this year. It should be part and parcel of an administration budget. So that's my opinion. It's not a question, but just underscoring what the chair has said. Thank you.
And much more eloquently done. Thank you, sir. Public comment, please, 1 minute.
Thank you, Madam Chair. Frank Meck. I work for Kathy Senderling McDonald at the County Welfare Directors Association.
Yes, you do.
First, we do want to appreciate the fact that the administration worked with us in really good faith to augment the current year budget for Medi-Cal. It was in recognition of a far greater than anticipated number of people who we got on the Medi-Cal program and a much more challenging automation environment that you heard about in a prior item. Those conditions continue to exist. We do concur with the LAO that it's premature to eliminate the COLA, and I think it's important to remember that it was an administration that originally proposed the COLA. There was no Medi-Cal COLA. And the COLA was consistently, or the counties were consistently underfunded to do the job. And what a prior administration found was caseloads were going up because we weren't doing redeterminations. And so costs were going up because we were paying health plans for people that were no longer eligible for Medi-Cal. And so they came to the counties and said, we need performance standards. We need you to perform. And we said, okay, well, we need you to sort of fund us fairly. And that's how the system came to be. Now, we haven't had a COLA since 2007, 2008. In the meantime, the Affordable Care Act has been implemented, and we've been working on an annual basis to sort of get it right. We think the legislature and the administration agreed to come up with a methodology to accurately fund the work. The cost of the work goes up. So if not a COLA, some other mechanism needs to be in place to ensure that we are funded to do the work. And when we develop the new methodology, we think would be the appropriate time to cross that bridge, not right now.
Thank you. Next witness, 1 minute, please.
Roseanne Berthrana-Rechka, SEIU, representing eligibility workers. We think it is also premature to eliminate the COLA. It's a cost of living adjustment based on the cost going up, not based on we already gave you money, so you should be happy with the money we already gave you. So we think that it's premature to eliminate it on an ongoing basis.
Thank you. Next witness.
Elvia Malvito, SEIU, representing Los Angeles County. Again, reiterating that it is premature since we don't have a new methodology in place. Also, fair to remind that although visiting the COLA once a year would be bothersome, we have constituents and workers who have to visit their budget daily. Thank you.
Thank you.
Madam Chair, members of the committee, Brian Allison on behalf of the American Federation of State, County, and Municipal Employees. Joining the growing chorus of folks who are saying that it is premature to strike the COLA right now. It's important to consider this within the full context of the budgeting methodology. And we want to also reiterate that it's important to include line workers in that conversation going forward. So as we take a look at developing that budgeting methodology, including line workers' input is incredibly valuable, not only for our workers, but for the clients as well. So thank you so much.
Thank you. Next witness.
Thank you. Good afternoon, Madam Chair and member. My name is Farah McDade-Tink for the California State Association of Counties. I want to associate my comments with Mr. Frank Mecca and his boss, Kathy Sunderling McDonald. And just note, I want to thank the administration again for the $150 million current year augmentation. The COLA that's proposed is for the coming budget year, and we do think it's premature to strike it at this time. Thank you.
Thank you. Next witness.
Libby Sanchez on behalf of Laborers Local 777 and 792. I want to align myself with the comments made by Frank Mecca and LAO and others before me regarding the prematurity of separating this out from the ongoing conversation that has to occur about an ongoing methodology. It would be a moral failure of the moral blueprint that Senator Monning mentions for us to do otherwise. Thank you.
Thank you. Next witness.
Tam Ma with Health Access California, ditto what Frank said on behalf of Kathy.
Kathy's the big boss. Actually, it's baby McDonald who's the big boss. Item number 10, thank you. Item number 10, we're gonna hold that item open so we can talk about the appropriateness of COLAs more. Number 10, financial audits workload.
Karen Johnson, Chief Deputy Director, Department of Healthcare Services. With me today is also Bob Sands, who is our Assistant Deputy Director of Audits and Investigations. So the Department of Healthcare Services is requesting these resources to handle the associated workload, new workload, with intermediate care facilities, developmentally disabled nursing and habilitative, and AB 959 public clinics and veteran homes. All of this is new workload, as I mentioned. The resources will be used to perform additional audits, about additional 150 to 200 audits of the ICFs annually. And we must use the facility-specific audited costs to calculate the rates for these facilities. With regards to the AB 959, which expanded Welfare and Institutions Code to include supplemental Medi-Cal outpatient reimbursement to state veteran homes and clinics operated by the state, city, county, and UC system and public health care system, we are going to be performing an additional 35 freestanding public clinics and 3 veteran homes. So AB 959 will be applied retroactively to fiscal year 2005-2006, resulting in a backlog of approximately 100 cost reports. Additionally, these resources will be utilized to address the dramatic increase in the number of filed appeals. These are complicated audits, and the resulting appeals will be complex. Without the resources, we'll be unable to comply with the state planned amendment and calculate rates and also address the clinic's financials. There was a question in the agenda to explain the delay in implementation of AB 959 for public clinics and the department's plan to become current in the payment to clinics. We were in negotiations with CMS from 2006 to 2012 with regards to allowable services. The SPA was approved finally in August of 2012, and we've been working on an implementation framework and expects to meet with the stakeholders by the end of this fiscal year. We'll begin webinar training, and program implementation was delayed due to program staff and auditing staff, and we expect that with these additional resources that we'll be able to complete these audits. And from there, I'll take any questions.
Senator Ronning, Finance or LAO? Public comment on this item? Okay, it's our recommendation that we'll hold this item open. Thank you for the presentation. Item 11, Healthcare Reform Workload Extension.
DHCS is requesting extension of limited term resources to continue the implementation of workload associated with the Affordable Care Act requirements. These resources will continue to configure and expand systems, will continue to provide oversight of the implementation of system enhancement and interfaces with other systems. Further, we will continue efforts to ensure compliance with ACA mandates with regards to provider enrollment. We'll be able to continue efforts to evaluate whether the application meets the regulatory requirements for participation.
Are you also going to present on the next item on the financial reporting resources?
I am.
Why don't we go ahead and have you do that,
Sure.
and then I'll open it up for public.
Sure. So DHCS is committed to being prudent, responsible fiscal stewards of public resources. The Federal Centers for Medicare and Medicaid Service requires states to do a quarterly cost reporting process, which is very complex. A year ago, the quarterly claim process totaled 1,400 pages. Today's claim, it is well over 2,100 pages. So these resources will be used to address the new federal mandated reporting requirements that have increased our current workload with Medi-Cal reporting. Some examples include processing an increase of $19.3 billion in benefit payments. We will be able to meet these mandates with these additional resources to address the Affordable Care Act reporting and provide the same level of accuracy, completeness, and timeliness of those financial reporting requirements.
Finance? LAO? Public comment on both items, please.
Good afternoon, Tam Ma with Health Access California. We support the department's request to extend the positions to continue doing the work of healthcare reform implementation. Thank you.
Thank you. We're going to hold both of these items open.
Okay. Thank you.
Let's move on to hospital quality assurance fee resources.
Sure, so we're requesting the extension of 9.5 3-year limited term positions to help us continue to do the work on implementing the hospital provider fee and the associated supplemental payments.
Finance? LAO? Any public comment? We're going to recommend that we hold this item open. Item 14, MLK Hospital Resources.
So this is a request for 2 new permanent positions to do the work required to implement the statutory obligations on the department for the financing of the Medi-Cal payments to the new MLK hospital when it opens later this spring.
Finance? Thumbs up. LAO? Public comment? We'll be holding this item open. Item 15, Meds and Securing Medi-Cal Eligibility Information Resources.
Correct. These resources are necessary to perform the ongoing workload of managing, protecting, and securing confidential Medi-Cal eligibility information, ensuring compliance with the Federal Social Security Administration, and monitoring access of the eligibility data system. MEDS is a robust database containing over 25 million records, which includes SSA data, personnel health information, and other confidential data.
Finance? LAO? Public comment? It's recommended that we'll hold this item open. Moving to the final item for today's agenda, item 16, Intergovernmental Transfer Program Resources, page 55.
So this is a request to convert 3 currently limited term positions to permanent and 2 new permanent positions to address the workload that we have in utilizing intergovernmental transfers to increase payments to managed care plans and therefore increase payments to safety net providers.
Finance? LAO? There's a question on the bottom of page 56. If you could respond to that, I'd appreciate it.
I apologize. Okay. So excited to be the last time.
See, it's my job to speed up the train or to slow down the train.
Certainly. So we are very supportive of figuring out ways to continue to expand our IGT program. We've seen it expand significantly over the last 10 years, and we are currently working with other public entities who are interested in putting up a match for the program, as well as working potentially on ideas with the fire agencies who are public entities who would also could potentially benefit from something like this. And so we are happy to do that and continuing to do that. There are some counties where we have essentially maxed out the use of this, but we are continually looking for ways that we can really benefit from the partnership with public entities and who are willing to put up match for us to improve the funding of the Medicaid program.
And so they have to be willing to put up the match.
That is what, yeah, that's what this program is about.
Okay. Any public comment on item 16? It will be our recommendation that that item be placed on hold as well. With that, I'd like to thank you all for your participation and attendance at today's Sub3 hearing. We'll meet again next Thursday. Thank you very much. Subcommittee stands adjourned.